Hello, welcome to yet another video of ANA. What do you mean by Asatmyendriyartha Samyoga? What is its relation between Dosha Dushti and the manifestation of Vikara or Vyadhi? How to understand them, interrelate them critically as well as clinically. This is the topic of this particular video. Dear ANA community, press the like button and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. Don't forget to press the bell icon so that the YouTube algorithms will be fitting you the right information at the right time for the right purpose. When you know or hear these terms, Asatmyendriyartha Samyoga, Dosha Dushti and Vyadhi, this is the topic of discussion in the PG curriculum of Roga Nidana. Actually, so these are the three, relative terms to an individual. Asatmyendriyartha Samyoga, Dosha Dushti and Vyadhi. So these are relative terms. The term relative in the sense that will be, unique to a particular individual. So these terminologies will be understood by individually applying in different real life case scenarios. Let us say for the example, so here the term is being mentioned indigestion. When you think about the indigestion, this particular indigestion is having different meanings in different individuals. For example, the person may present with bloating sensation in the abdomen. Some others may be associated with vomiting. Some others may be presented with loose motion. Some others may be presented with constipation. All they are considered to be, the categorized under the heading of indigestion. In the same individual, indigestion may have different meanings. Same individual in the morning, he may say he is having the lack of appetite or the lack of tastelessness or the lack of taste. Some other way, the person may be having nauseating sensation. In the same individual, some other time period, he may say it is something related to constipation or diarrhea. In that way, so whenever you think about these terminologies, that has to be properly known what actually is that refers to in a particular individual while you are going to make a diagnosis accurately. When you think about the terminologies, Asadma Indriyartha Sanyoga, it is being mentioned. Kalartha Karmanam Yogo Hina Mithyadi Matrakaha Samyag Yogascha Vijnayo Rogarogyaika Karanam. So here it is nothing but the three ayatanani, that is Asatmyendriyartha Sanyoga, Prajnaparada and Parinama. So here we are going to discuss about the Asatmyendriyartha Sanyoga as such. So here the term Artha refers to Shabda Sparsha Ruparasa Gandhaha Mahabhuta Gunaha. In the sense, we are going to analyze the interpretation in terms of the Shabda, Sparsha, Rupa, Rasa and Gandha. So, and when you think about the abnormalities, so they are going to have the three different subways, that is Hina Yoga, Mithya Yoga and Ati Yoga. When you think about the Hina Yoga, the person is having the Indriyartha Sanyoga with that of the Indriya will be to a lesser time duration, whereas Mithya Yoga, improper time duration, whereas Ati Yoga refers to excess time duration of contact with the Indriya along with the Indriyartha. So they are considered to be responsible for the disease manifestations in the body. Whereas the proper contact with the Indriya, with that of the Indriyartha, along with the, the Atma and Mana, there will be the proper health that can be attained or maintained. Whereas the term Dosha Dushti refers to Rogastu Dosha Vaishyamyam, Dosha Samyam, Arogata. When you think about the terminology, so here Dosha Dushti is the one that is responsible for the disease manifestation. So here The term dosha vaishamya refers to swapramanad ekasya vayoh trayanam vruddhihi. So there will be the possibility of abnormal increase of one dosha or two dosha or all the three dosha that may be observed. Or there may be the possibility of the increase or decrease of the dosha that may be possible. Or there may be the possibility of increase of one, two or more guna that may be possible in an individual. Or we are going to expect the involvement of any one particular part of the body, multiple parts of the body that may be associated with abnormal dosha dysfunction. Which particular function you got abnormal? Whether is it the what you say that the utsaha or uchvasa or nishwasa or vega pravartana abnormally happening, that has to be known. Which particular time period? Whether is it in the morning time or noon time or after the what you say that the evening time, or whether is it in the specific season? Is it in the spring season or rainy season or winter season, etc.? Or regarding the age of an individual, there is it the manifestations are occurred in the childhood or a middle age or adulthood. So all these are considered to be should be taken care of whenever if you think about the analysis of dosha dushti. Regarding the place of an individual, whether the person is being born, where the person is being grown, or where the person is being getting diseased. Is it in the Jangala Desha or Anupa Desha, Sadharana Desha? So that will be helpful in predicting the accuracy in terms of the dosha dushti. Plus, even occupation of an individual has a significant role in identifying the dosha dushti. For example, if the person is doing the night shift, specifically the watchman in different bigger institutions as such, so there will be the abnormal increase of Vata dosha in the body because of a lack of a proper sleep at night time. Whether is it associated with physical stress or psychological stress, that has to be analyzed whenever if you are planning to make the accuracy in terms of the dosha dusthi analysis. Regarding the Vyadhi, it is being mentioned that Tadduka Samyoga Vyadhaya Uchante. It is being mentioned that if the person is having the presence of either one or multiple, what do you say that distressing symptoms or life-threatening symptoms, etc., then we are going to say the person is suffering from Vyadhi. Further, the Madhava Nidana says, Tatavida Dosha Dushya Samurchanaji Vishesho Jvaradi Rupo Vyadhi. So that will be the clinical correlation between the Nidana, Dosha, Dushya, plus Upadrava, etc. All they can be connected properly. Whenever we are going to analyze the Vyadhi, these are the following points has to be answered whenever if we are planning the accuracy in Ayurveda diagnosis. Regarding the examples, regarding the application of this, there are certain factors which are considered to be responsible for or knowing about the causability of Nidana. For example, Prakriti of an individual. If the person is going to indulge in the consumption of this particular type of the food substance, and if the person is Vata Prakriti individual, then we are going to expect Vata Prakopa there. If the person is Pitta Prakopa Pitta Prakriti individual, then we are going to expect the Pitta Prakopa may be observed in an individual. So, and when you think about the whole food substance, it is something related to Ushna, Tikshna, Guna substances as such. Hence, the person who is considered to be Vata Pitta individual, then we are going to expect the increase of the Pitta rather than Vata. Physical strength of an individual also the deciding factor for predicting the causability of an illness. Is it the which particular dhatu is being afflicted? Whether is it Rasa dhatu is being afflicted or Asti dhatu is being afflicted or Shukra dhatu is being afflicted, which will be helpful in predicting the curability and incurability of an illness. Mental and emotional strength of an individual also counts a lot whenever if you are planning the prediction in terms of the causability of Nidan. Whether he is unstable, or Rajo Dosha dominance, then the person is likely to take less amount of the food substances or even medications also. Hence, the will be having an indirect or deleterious impact on the manifestation of a, what do you say that, or maintenance of health in an individual. Environment of an individual where he is living. Is it Jangala Desha or Sadharana Desha or Anupadesha, or whether is it in the joint family or nuclear family, etc. That will be counted. Source of entry of Nidana. So, whenever if you think about this particular as a Nidana, source of entry of Nidana will be specifically oral cavity. In the sense, the person will be likely to have the abnormal increase of pitta in the alimentary canal. Depending upon the gunas of the substances, the person may have the abnormal increase of laghu, tikshna, and ushna guna in the body. Plus some amounts of snigdha guna that is going to get increased in the body. Suppose if the person is having this particular substance holding in the hand for more than 5 or 10 minutes, then we are going to expect the impact of these substances on the hand. Number of Nidana exposure. If the person is going to consume one plate of gobi Manchurian, he may be having the Pitta Dosha Prakopa. As the person is having the taste in the mouth as such, if the person is going to consume 3 plates of the gobi Manchurian, then we are going to expect much more increase of the Pitta Dosha in the body than the previous example. If the person is going to consume the 5 plates of gobi Manchurian, then we are going to expect abnormal increase of Pitta Dosha in the Mahasrotas of the individual who is going to do this particular Nidana. In this way, so the factors they are going to decide causability of an illness. So here, when you think about the clinical manifestations are mainly related to what do you say that the alimentary canal dysfunction. Then when the person is having an exposure to this particular type of nidana, then we are going to expect pitta dosha increase in the alimentary canal. To sum up, Asatmyendriyartha Samyoga Pradyaparadha and Parinama, they are considered to be the relative terms. The term relative in the sense that may be true for an individual, but the same may not be true for second individual. For example, the indigestion. When you think about the indigestion, sometimes the bloating sensation in the epigastric region, sometimes the loose motion, sometimes nausea or vomiting or lack of taste, etc. So they are considered to be mainly associated with what you say that Asatmyendriyartha Samyoga, etc. These terminologies has to be defined accurately or properly. These terminologies has to be applied based on the real life case scenarios to understand the deep understanding towards that particular subject. Based on the nature of Asatmyendriyartha Samyoga, one has to frame the samprapti to break down sequence of pathological events or events of the samprapti. Dear ANA community, that is what we have discussed today. What are the major key takeaways from today's discussion? Mentioned in the comment box below. What is the one video that active in coming days in this particular channel? Mentioned in the comment box below. And spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. Thank you once again. Something more in the next video. Thank you.